So your first question is going to be which IVF is best for a 40-year-old?
Okay, well, that's a good question because one of the reasons why infertility is such an epidemic that everybody's talking about everywhere in the world is that we're putting off childbearing because life is so different. We figure we'll live to 100, and there's so many opportunities when you're younger. Many couples, many women just don't think about having a baby till they're 40. But by then, the vast majority are infertile. So what happens is that two things happen as the woman gets older. The number of eggs goes down, but also the fertility of each egg goes down. So it's a double whammy. The eggs themselves aren't as fertile, and we have less of them. So certainly, when a woman is 40 years old, the ideal approach is mini IVF. And I can answer it first place. The intuitive response of many doctors is, well, she's that old, she doesn't have that many eggs. We'll bomb her with a huge dose of these hormones so that we'll get more eggs and better eggs. And that's the opposite of the truth because with that huge dose of hormones, FSH and LH, and a gigantic overdose, you actually hurt the eggs. We have 4 to 5 times higher baby rate per egg with a much more minimal stimulation. And the other thing is the value of just preceding the IVF procedure with birth control pills to kill off all the bad quality eggs that have been accumulating in every woman's ovary. And particularly if you're 40 or older, you can't afford that. And so there's other aspects to it, but with this mini IVF approach, which I certainly recommend for any 40-year-old, we really get better quality eggs. Now, if you're 25, it almost doesn't matter what you do because there's so many good eggs. But mini IVF is better even for the younger woman with lots of eggs. At any given age, you want to analyze it. At any specific age, the baby rate per egg is 4 to 5 times higher with this protocol. Dramatic difference. So when you're talking about women 40 or 41 or 42 or older, you really can't afford to be ruining the eggs with a more conventional protocol. So I would recommend highly the mini IVF. We always get the best quality eggs that way. And when we have new embryologists that have never been in our lab, but in other labs, they all say, oh my gosh, these eggs look so fantastic. There's better membrane elasticity, better cytoplasm. They can just see it. It's not just the result, but they can see it when they're handling the eggs. So that's my answer to you, mini IVF for 40-year-olds.